In addition to signing the latest coronavirus response package sent to him by Congress, the president also signed the Defense Production Act today, and it could invoke wartime authority over production of certain equipment. Joining us now to talk about what role the military might eventually play, Congresswoman, presidential candidate, and major in the Hawaii National Guard, Tulsi Gabbard. Good to have you with us live.
Thanks, Shannon. Great to see you.
Okay, so you know, as somebody who still deploys and activates as a National Guardsman, what this could mean. And I know that there's a hesitance from some people who say, listen, some of the people that we need are key in their civilian lives, too. They're medical professionals, or like you, a lawmaker, or doing other important things. What would it mean to have more of the National Guard mobilized?
Look, I think that this is going on a state-by-state as-needed basis, but this is literally the role and the function of the National Guard, to be able to step up and to provide essential services during times of crisis, just like this. My first 4 years in the Hawaii Army National Guard were spent serving in a medical unit, deployed to Iraq. We were there for nearly a year. I served with amazing medics and doctors, PAs, nurses, and dentists, all of whom, yes, they have civilian jobs here, but who are ready to respond in a way that sometimes only the National Guard is best equipped to do so. And in like states across the country, I know here in my home state, people are standing ready should that activation occur, myself included.
Okay, so you are a multitasker. You've been here in town in Washington, where the Senate has now finally passed the House package with some technical corrections to it. And now we're looking at a third package already. There are concerns about the price tag for this, and some people saying, hey, let's put the brakes on. Let's see where we are. Let's get a little perspective on this before we commit billions, trillions of future funds down the road. Where are you in this whole process? As now we're talking about the third package.
Yeah, we're talking about people's lives here. We're talking about their health and safety and well-being. And I think if people are looking for perspective, look at what's happening in some of these other countries around the world, and let that be a warning to our leaders to say, hey, we need to take action now. We need to take action to make sure that we have the medical equipment, that we have the masks, the testing kits, the ventilators, that we have what is necessary to ensure the health and well-being of the people of this country, number one. And number two, for those who are getting impacted, those who are getting laid off, freelancers, Uber drivers, contractors, people who are losing their livelihoods because of this global pandemic, we need to provide this direct aid. I introduced a resolution last week before leaving Washington saying that we need to provide a minimum of $1,000 a month to every adult American tax-free in this country to cut the red tape and bureaucracy, get this aid directly in their hands so they can make the best decisions for themselves and their families. And I'm glad to see President Trump, Democrats and Republicans really starting to push for this kind of direct emergency assistance.
All right, a couple of other questions for you. First of all, as we had Congressman Nunes on a little bit earlier, there are now 2 members of Congress who have tested positive for the virus. You've all been working together, working around the clock in very close quarters. Will you get tested? Do you have any concerns for yourself?
I think that every member of Congress should get tested. I think that more people in this country should get tested, both those who have symptoms and who are concerned, maybe those who don't have symptoms but who have been exposed to someone who has, or who've traveled to some of these other, not only other countries, but communities in this country who are experiencing some of these outbreaks. We have to learn from what we've seen has worked in South Korea, for example, where they've tested hundreds of thousands of people and therefore better able to contain this virus and reduce the threat. And they're one of the few countries at this time of a global pandemic that are actually seeing their numbers drastically decrease. I think it's important for Congress to exercise that leadership. The CDC, the FDA, they got to break through the red tape, get rid of this very narrow testing criteria that's standing in the way of larger scale testing across this country, and do whatever it takes to be able to make sure that these tests are available for free, easily accessible, without bureaucracy, doctor referrals, or any of these other things that are standing in the way of people being able to keep themselves and their loved ones and communities safe.
Okay, and very quickly, you're still a part of the presidential race, the Democratic field. There's growing now very verbal push on Senator Sanders to drop out and to allow the former vice president to simply become the nominee at this point. What are your thoughts on that?
Senator Sanders will make his own decision. I'll be making an announcement about the future of my campaign tomorrow morning.
Okay, that's a tease. We will tune in. Congresswoman, thank you for coming back. Always good to see you.